All right, let's dive right into this explainer. Today, we're investigating a silent biological engine that's literally multiplying our risk of death, often without us even knowing it. Historically, doctors called it Syndrome X. Sounds like a sci-fi villain, right? Well, today we know it as Metabolic Syndrome, and it's quietly operating in the background of millions of lives as we speak.
Check out this number, 33.4%. According to comprehensive health data, that is the chunk of U.S. adults currently carrying this hidden syndrome. To put that into perspective, that means roughly 1 in 3 people watching this explainer right now are actively affected by this metabolic dysfunction. 1 in 3.
So, to solve this medical mystery, we're going to map out exactly how the whole thing works. We'll cover the hidden epidemic, how to spot it, the insulin resistance engine, the deadly domino effect, and finally, reversing metabolic syndrome.
All right, part 1, the hidden epidemic. We're looking at a population-wide crisis here.
And the data shows us exactly how this risk absolutely skyrockets as we age. Look, if you're a young adult between 20 and 39, the prevalence is sitting at about 19.5%. But fast forward to folks 60 and over, that number jumps to a staggering 48.6%. It's affecting nearly half of all older adults. And interestingly enough, at that age, women actually become even more susceptible to it than men.
Moving on to part 2, how to spot it. It's time to play medical detective. Now, since this condition is largely asymptomatic, meaning, you won't necessarily feel sick or have obvious red flags, we really have to rely on clinical clues. And clinicians use this brilliant memory tool called the Hatch mnemonic. It stands for hypertension, abdominal obesity, elevated triglycerides, low HDL cholesterol, and hyperglycemia, which is just high blood sugar. The absolutely crucial takeaway here: having just 3 of these 5 clues means you officially have metabolic syndrome. That's it, just 3. But there's a really fascinating clinical pearl hidden in the data. Abdominal obesity is definitely not a one-size-fits-all measurement. For example, the danger threshold for men in the US and Europe is 102 centimeters, but Asian populations actually develop the syndrome at much lower waist thresholds, down to just 90 centimeters for men. Why? Because Asian populations generally carry a higher visceral to subcutaneous fat ratio. Basically, even less visible fat can still equal high metabolic danger.
That brings us to part 3, the insulin resistance engine. Let's look at this broken engine.
So, the unifying driver of this entire syndrome is insulin resistance. Think of it like a broken lock and key system. Your body is doing its job, producing the key, which is insulin, but the locks on your cells, they're completely jammed. They literally refuse to open their doors to let glucose in. And because that glucose is locked out, it triggers this unrestrained fat breakdown and a wave of systemic inflammation.
And this is where we need to reframe how we think about fat. Visceral fat, that deep belly fat, is not just passive storage holding on to extra calories. It is an active, highly toxic endocrine organ. It's literally pumping out inflammatory markers called adipokines, things like TNF-alpha, IL-6, and resistin. These chemicals circulate right through your blood, cranking up inflammation and making that insulin resistance we just talked about even worse. But here's where the biology gets truly wild. It's known as the adiponectin paradox. See, adiponectin is the one and only chemical secreted by fat that is actually anti-inflammatory. It actively tries to protect your insulin sensitivity. But paradoxically, as your dangerous visceral fat increases, this one protective chemical drops. It's crazy. The more you need it, the less your body makes. Which leads us right into part 4, the deadly domino effect. Let's talk about the collateral damage. The landmark Inter-Heart study revealed some pretty terrifying risk multipliers. Having metabolic syndrome doesn't just add a tiny bit of risk, it exponentially multiplies it. Your risk of dying from cardiovascular disease doubled. Your risk of a heart attack or stroke tripled. And your chances of developing full-blown type 2 diabetes absolutely skyrockets by 3 to 5 times. It's a massive domino effect.
And this broken engine drives other severe, system-wide issues too. It acts as the root cause for metabolic-associated fatty liver disease, which actually affects up to 65% of patients with this syndrome. It also deeply impacts fertility. For instance, in polycystic ovary syndrome, or PCOS, insulin resistance is a central, driving feature in up to 80% of all cases.
Oh, and here's a vital exam tip for clinicians that we should honestly all be aware of: obstructive sleep apnea. Sleep apnea actively ramps up your sympathetic nervous system and dumps more of those pro-inflammatory cytokines into your body. It's so deeply tied to this metabolic engine that simply having sleep apnea can actually predict metabolic syndrome, even in patients who aren't clinically obese.
So, facing all these odds, the multipliers, the systemic damage, we have to ask the million-dollar question. How do we stop the engine? Well, we're going to need a highly targeted, evidence-based approach to dismantle this syndrome piece by piece.
And that brings us to Part 5, Reversing Metabolic Syndrome. Let's look at an actionable roadmap.
The good news? Weight reduction is our primary weapon here, and it works. Creating a 500 calorie per day deficit mixed with 60 to 90 minutes of daily physical activity and some long-term behavior modification completely rewrites the math. Literally, just losing 5 to 10% of your body weight directly improves your insulin sensitivity and favorably modifies every single component of the syndrome we've discussed today. Now, when lifestyle changes just aren't quite enough, we pull from a specific pharmacological arsenal. Statins are usually our go-to first choice to drastically drive down that bad LDL cholesterol. But if dangerous triglycerides are the primary issue, especially if they're spiking over 500 and threatening to cause pancreatitis, we deploy fibrates. Those can aggressively drop triglycerides by up to 45%.
And for the high blood pressure component of the syndrome, we don't just throw any medication at it. For patients without diabetes, we specifically rely on ACE inhibitors or ARBs. You might wonder, why those specifically? Well, it's because these drugs don't just lower blood pressure. They actually offer additional renoprotective benefits, acting as a shield for your kidneys against the damaging effects of insulin resistance.
We also absolutely have to talk about the massive medical revolution happening right now: modern weight pharmacotherapy. Drugs like GLP-1 receptor agonists such as semaglutide and dual agonists like tirzepatide have completely transformed the treatment landscape. By targeting the core issue of obesity directly, they're yielding massive weight reductions, up to 20.9% with tirzepatide. They're quite literally fixing the root cause of the syndrome.
But I've got to give you an essential warning here. Human biology is infinitely complex. Take nicotinic acid, for example. It is literally the only drug we have that predictably raises your good HDL cholesterol. Sounds great, right? Well, clinical trials show that combining it with a statin provides absolutely zero cardiovascular outcome benefit. Just forcing a good number up on a lab test with a drug does not always equal better health outcomes. Which brings us to our final thought. The medications we have today are incredibly powerful, no doubt, but the data clearly shows that lifestyle intervention remains the absolute most potent medicine we have for shrinking visceral fat and repairing your metabolic engine. So, the question I want to leave you with is this: what small daily habit will you change today to reverse the clock? The true power lies in our daily choices, leaving us to wonder just how quickly we can reclaim our metabolic health. Start small, and let's get that engine running smoothly again.